Hey everyone, thank you for watching this podcast, the Powered by Iron Health podcast, where we're here to create a community that raises the standard of health and wellness. I don't say that lightly. The medical field is crazy. If anyone's in it, they understand what's going on. You have all these private equity firms, all these venture capitalist firms. They're buying everyone, and it's changing what's happening. And we're going to talk a little bit about that, what that means. But the focus of today is really going to be on physical therapy specific. And what I'm seeing in the field is that a lot of PTs are leaving the profession. So we're going to talk about the why behind that, and then we're going to talk about what that allows us to be pivoting to in the future, and why PTs shouldn't be leaving the field. This is an amazing field. We get to help people every single day. So things we need to put in order to make sure that we attract the best talent and get the best people to do the job. So I have obviously I've been doing this a while. I have a network of medical doctors and people that I know very closely. And I listen to a lot of what they say and what's going on in their particular practices. In the last couple of years, I would say even the last 2 or 3 years, 2 medical doctors that I know, surgeons who were private, had to sell their practices because they just can't do it anymore, because insurance is getting too hard, client management is getting hard, managing staff is getting too hard. So they're pivoting to be a part of a bigger group. Now, these groups that are coming in, they're private equity. And if you don't know what private equity is, it's pretty much just people in finance who may or may not have medical experience buying these practices and running them like a cold business. They just look at the bottom line and try to get and do what they have to do to make sure that they're making more profit. Now, it has its positives, it has its negatives. Yes, in any medical, it is a business. That is something to take into note. All these things are a business. There still needs to be a profit at the end of the day. People still need to eat. People still need to survive. The negatives are when you have someone who comes in who's not connected to the actual business and boots on the ground. They look at everything on spreadsheets. So they will make choices based on what is going to be the best profitability for what they need to do. So one thing that is happening, especially in hospitals, is they're creating a different pay scale. And I bring this to light because it's happening in PT too, in physical therapy, where they give PTs a base salary, which is not that much, and then everything else that they make is based on their productivity. It's happening across the board. Now think about it. If you're in hospitals and you only make more money when you see more patients or prescribe more medicines or do more procedures, what are you incentivizing? You're actually starting to incentivize people doing more things that might not necessarily be necessary. And that's a sad truth of this. It's happening time and time again all over the board. In the next couple of years, I don't know how long, but you're going to see a massive divide between these big groups and then private people who don't take insurance, concierge medicine. It's going to be a massive divide. And that's all you're going to have. You either have to pay for it or you're going to have to go to somewhere that they don't care about you. So this is something high level picture of what's happening in the medical field as a whole. And PTs, we're not subject to this. This is happening in the PT world too every single day. So during COVID, I think something like 30,000 PTs left the profession. And there's a couple of reasons that I believe why it's happening. And I'll outline a few of them, and then we'll go into what we need to do to change it. So the first reason is burnout. If you work, particularly in the Northeast, like our clinics are in the Northeast in New York and Connecticut, you work in those areas, to actually survive when you're an in-network clinic, you need to see 4 or 5 people an hour to actually make any revenue. So what does that mean? That means that the PTs have 5 people an hour on their schedule, right? They're seeing 20, 25 people a day. Now, how can they possibly deliver the best quality care, deliver a holistic approach? How can they deliver a customized program to each person? They can't. That's the outline of this. They physically cannot. When you see 25 people a day, you know someone has back pain at 9 o'clock and 10 o'clock. They're getting the same treatment. So what that caused was a frustration with PTs, and that is warranted, right? Like it's not uncommon for that to happen. If you're seeing 25 people and all you can do is X, Y, and Z, then yes, it's gonna cause this burnout. Because then what happens? People have to take notes home. They have to really not give mental attention to people. It's creating this disdain to the profession, and that is the truth of it. And it's only getting worse, you know. And I know this could be like more doom than anything, but it's getting worse. Insurance companies, how they are a big business. They don't want to pay. It's the sad reality of it. I mean, there's a whole course of PT now that's cash pay because we see what's happening in the world of insurance, and we have for us to play the game and survive. It's very challenging. So that is causing a lot of PTs to leave, right? And I think also it's hard if you're an outpatient. You know, I think it's something to note if you are a PT out there, or if you're thinking about becoming a PT and you like outpatient in sports and orthopedics. It's very, very challenging because your schedule is not a 9 to 5. You have to see people after work. You have to try to do events to get people to come through the door. You have to help as many people as you possibly can. And that takes time and effort. So PTs are realizing like, hey, is the juice worth the squeeze here? Is me putting in these many hours going to help my life? And right now it doesn't look like it is. That's the sad reality of this, you know. And I will say I have people who ask me about PT school early on, and I'd be happy to talk about it. But they ask me like, hey, I'm thinking about PT. What should I do? My first gut reaction is like, if you don't get school paid for, you can't do it. Because what PTs get paid to actually what they pay for in school, it just doesn't equal. This is like the sad part of it, right? So we'll focus on that sad part first. But there is a positive to it, right? Let's start with the big positive. When you're in the physical therapy field, you're actually helping change people's lives. Like I have clients who've been with me for a long time, and I know their families, I know them, and I'm able to help them, and they appreciate us for that. So like the reward for your emotion is 100%. Like you're able to actually help people. It's pretty amazing. So if you are about that life of service, PT is very, very valuable. If you, this is the positive here. There is a silver lining with PT, right? And I think I say this all the time. When you have a medical field like we have, where you're going to have a divide between concierge and very top-notch service, and then stuff that's just a run-of-the-mill, the concierge service, like we have the most potential here. We could get to educate people and get them to come through the door and really help way more people than any other place possible, right? So there's a lot of positives there. For PT too, you know, it's something to note. There, with all the people that did leave the profession, there's a lot more room that's going to be there to grow if you go into it, right? I think I heard the other day, PT businesses are growing year over year. So we see all this doom, but it actually, in reality, it's growing. People are becoming more educated. You have baby boomers who need more PT. You're helping more people. So it's very positive there. Something to know too, as a PT, you don't need to go into orthopedics. You can go to a hospital and have a lifestyle that you like. You can work anywhere around the country. It's very valuable. So these are some big positives. Now, the other thing is the opportunity to be the best is there because there's so much crap out there, honestly. We have the opportunity to help change the profession totally. So I always talk about Vision 2020. That's what they pitched you in school. It's 2024. It's not there yet, but the PTs are going to eventually be the primary people. When someone has an injury, my shoulder hurts, they're going to go to a PT first. And I really believe that that's going to start to happen in the next 5 to 10 years. So it's going to allow us the ability to be those gatekeepers to say, hey, this person really needs more medical attention, or hey, we can help this person. So if you want that autonomy and you believe that you can really help someone, it is a great profession. And we'll also be at the top where PT is going to be kind of that top level degree for anything health related for the physical body. So you'll have PT running massage, acu, personal training. Like we'll be able to see that and understand what someone needs and then prescribe the recommended based on that. So there's a lot of positives here. Also, again, the profession is always changing. You go into PT because you love it, and you go into PT for what the future holds. Like you see out there on all social media platforms and all these programs, what people are doing now. It's like people are going to start to want to come to PT even for training, right? Like they're going to say, hey, why would I go to a trainer if I can go to a PT and get a higher level education and be better and prevent injuries for the long term, Prevention is going to be the new thing. And PTs will be the ones leading that level of prevention. So those are some positives there. Now, the way we shift it is it starts within. I always tell my team that, right? We have to believe in what we offer. We have to believe in our value. We have to believe that we help people. And then we have to come out and tell people like, hey, this is what we do and who we are. And then people will be attracted to that. So have a self-belief there. So if you're right now on the border of like, what should I do for school? My honest opinion would be if you go to PT school, try to go to a school that's affordable, or if you're getting, help from your parents or someone, great. It's going to be a great profession. You're going to have a great career. If you're not, you're going to take out loans and stuff like that. Really think about what you want to do, what your next 10 years look like. Think it to the future. Think about what it's going to look like in 10 years and what your lifestyle wants to be, because that's the important question you have to ask yourself. I love PTs as a whole, and I think it's going to only continue to advance. So if you have any specific questions on that, let us know. Thanks for watching.